Chapter 61 Peripheral Nerve and Spinal Cord Problems. In this chapter, we're going to focus on trigeminal neuralgia, Bell's palsy, Guillain-Barré syndrome, and spinal cord injuries. I put the trigeminal neuralgia and the Bell's palsy into one slide, just try to compare two diseases for the differences, because these two diseases are kind of confusing. They have some kind of similarities. Trigeminal neuralgia and the Bell's palsy, they both involve cranial nerves, which is part of the peripheral nervous system. But for trigeminal neuralgia, they only involve trigeminal nerves, which is the cranial nerve 5. The coverage of the distribution area for trigeminal nerve will be the mouth, cheek, forehead, and the nose. So when patient develop trigeminal neuralgia, patient will describe the pain area to be around mouth, like lips, gums, cheek, forehead, or side of the nose. And the pain will be described as the sharp pain, burning pain, which is kind of a neuropathic pain. But for Bell's palsy, it's not about the sensory problem. It's about the motor function, dysfunction, paralysis. So the involved cranial nerve is the facial nerve, which is the cranial nerve 7. And when patient develop Bell's palsy, patient will show flexidity of affected side of the face, and will have a drooping on the affected side of the face, and will not be able. Some patient may not be able to close eyelids, and patient usually does not have pain, not like neuralgia. Trigeminal neuralgia will have a really severe pain, but for Bell's palsy, pain is not issue usually. And some patients may have hearing problems, hearing deficits, or hearing the noise, tinnitus. And the triggers will be different for these two diseases. Trigeminal neuralgia, the triggers usually are some environmental problems such as extreme temperatures, too cold, too hot. Patient drink some too hot water or cold water, ice chips, and could cause pain, could trigger the problem. Or patient brush teeth too hard, chewing too hard, talking too much. These could be the triggers. And Bell's palsy usually is associated with virus infection, some viral meningitis, or the what's that? The herpes infections, some virus infection, just comes and goes. When patients under stress, recently get sick or get tired, the virus become reactivated, and the patient will develop a Bell's palsy, and trigeminal neuralgia. Regarding the length of the duration of the problem, I could last for minutes or longer than days. And Bell's palsy usually need immediate attention. Need to get immediate treatment right away. Otherwise, it could become a permanent damages to the nerves. So usually, patient can recover within 6 months, but we do have some patients will have a permanent paralysis on the face. For the treatment, trigeminal neuralgia. The conservative treatment will be the major strategy that patient take. In this disease, like regular opiates medication, pain medication may not be able to work to control this neuropathic pain. Patient usually need to take anti-seizure medications such as Tegretol, Tegretol, which is the most common one, or patient take Neurontin, another common anti-seizure medication, or tricyclic antidepressants, Elavil. This medication working on block the pain signals to be transferred to the brain and then to control the pain. And if the medication is not so effective, patient does not respond to the drug therapy very well, patient may need to have some kind of surgery that we called rhizotomy. The most common, well-established surgery is glycerol rhizotomy. So, doctor will inject a chemical which is called glycerol to freeze the nerve, to damage the nerve and block the pain signals to be transferred to be sent to the brain. So the patient will stay alert during the procedure because this injury involve involve the cranial nerves. The surgeon need to test because they have to select the target nerve to inject the glycerol. But they need to be careful not to damage other important nerves. And so then during the surgery, doctors usually asking questions to the patients, check their sensory function, motor functions. So patient need to be awake during the surgery. So we need to let the patient know. And after the surgery, patient do not need to stay in the hospital overnight. They can go home right away, but need some, you know, need a ride to take them to home. And some patient may have some permanent damages from the surgery, though, or some residue effect from surgery. For example, numbness on the face, and or some other kind of damages. It's a hard. So some patient may have a problem with sensation function on the face, but usually the success rate could be over 90%. And for nursing management, we'll focus on like during acute attack when we need to set our priorities. So the priority definitely will control the pain because this is neuropathic pain. And pain management will be priority, but also the other things very important is to maintain nutrition and oral care during the acute attack period because the patient are afraid of pain. They cannot chew food very well, so maybe they need to take some kind of a liquid type of food, and they would not to brush the teeth during a acute attack, so need to make sure patient need to maintain good hygiene in the mouth. And also, if a patient need to go for surgery, need to provide education about what are expected during the surgery, such as the patient will stay awake during the surgery, and after the surgery, some patient may experience a numbness on the face. It could be permanent. For the Bell's palsy, the treatment it's kind of like just control the inflammation by taking corticosteroid medication and use moist heat to massage the face, and patient might need to take some antiviral agents to help to control the virus infection, and some alternative therapies such as acupuncture works very well for this type of problem. And for the nursing management, maintain nutrition and oral care also is an important, similar to the trigeminal neuralgia, because the patient develop a paralysis on the face and they have a hard time to chew. and there might be some food left in the oral cavity after eating, so you want to kind of check and provide oral care if necessary. Some patients will not be able to close the eyelid, so they need eye protection. Keep eye sheet to cover the eyes during the night. Use artificial tears during the day to keep moisture to prevent the ulcers in the cornea area. And some patients may have disturbed image issues, will not to see the friends and go to the public settings, and we need to provide privacy for the patient and maintain also help them maintain a positive self-image. Guillain-Barré syndrome. Guillain-Barré syndrome is very similar to the multiple sclerosis. They have the same pathophysiologic mechanisms, which is due to the demyelination, the damages to the myelin sheaths. The sources of the problem could be different. For multiple sclerosis, it could be the virus exposure to the virus or some other kind of infections. Guillain-Barré syndrome usually tend to be acute attack. Usually patient have, for example, for past 1 to 3 weeks, the patient have a history of GI infections or flu or taking some medications that the patient is allergic to. And then patients start to have this very progressive polyneuritis. And the locations are different between Guillain-Barré syndrome and multiple sclerosis. Multiple sclerosis really involve the central nervous system and the spinal cord, and Guillain-Barré syndrome involve cranial nerves and the peripheral nervous system. So the characteristics for Guillain-Barré syndrome is have two type of manifestations. The most typical progresses start from the feet and then ascend. It will be like ascending trend, gradually progress to upper extremities and to the arms, and the patient will develop paralysis and also weakness on the extremity, usually is symmetric, and the patient also experiences severe pain. On the other side, more critically, patient will have some other more critical issues. Because if autonomic nervous system get involved, it could interfere with cardiovascular and breathing functions and then also internal organ movements. So for the sympathetic nervous system, which is taking care of blood pressure, heart rate, and breathing, when patient develop Guillain-Barré syndrome, a patient will have fluctuation the blood pressure, could develop a dysrhythmia, and also the respiration function could be paralyzed if the nerve in the thoracic area get involved. And also patient could develop swallowing difficulties, dysphagia, and for the bowel and the bladder dysfunctions, which is taken care of by the parasympathetic nervous system, and patient could develop paralytic ileus, could develop bladder dysfunctions such as retention, the incontinence problem. But overall, the Guillain-Barré syndrome is reversible once we can identify the source that trigger the immune system to develop antibodies to attack the myelin sheaths. We can remove that source and then patient can recover completely. Usually maybe take about 3 to 6 months. So not like multiple sclerosis, which is a slow progressive process. It's slow, but it's irreversible overall. The trend is getting worse. So for the treatment for Guillain-Barré syndrome, the treatment will focus on the priority, which is for the respiratory support. If a patient develops respiratory failure, usually we can monitor the oxygen pressure in the artery from the ABG to identify if, for example, oxygen pressure lower than 70 millimeter for mercury. It's a good indicator for intubation and ventilation, mechanical ventilation. Usually patient need to be on ventilator up to like 2 weeks during the acute attack problem. And also we need to do the physical therapy to help patient remove the secretion from the lungs to prevent the pneumonia. Usually patient could have infections such as pneumonia due to the immobility. And also, we need to focus on the cardiovascular functions and also DVT and the PE. These complications from immobilities too. What for patient blood pressure, heart rate, breathing patterns, and the signs of short of breath, which could be signs of PE or DVT symptoms. And usually patient will be taking some anti-inflammatory immune suppressants and also will receive immunoglobulin, high dose immunoglobulin to combat with the virus bacteria. Um, and some patients may take immunosuppressive medication such as corticosteroid, but it doesn't really show significant effect on controlling the disease. Um, Also, we can use plasma pheresis to wash out the antibodies in the plasma. For nursing management, we focus on identify and prevent the complications from the immobility and the paralysis. A patient if have respiratory failure and early identify the signs of respiratory failure or problem with the chewing to prevent aspiration. Um, Monitor patients for hypoxia or pneumonia and provide anti-tube or parenteral feedings to maintain nutrition, adequate caloric needs. Some patients, if develop dysphagia, they also need the support, the nutritional support, and need to take precautions against the dysphagia. And other concerns could be DVT and the PE. So some patient may need to take a subcutaneous heparin shot, and the pressure ulcer also is an issue. Have to be carefully positioning the patient and change the posture frequently, do range of motion, and also pain management to help control the neuropathic pain and also for the bowel and the bladder dysfunction. If necessary, do the straight cath or indwelling catheterization, and also watch for the signs of a UTI. And some patients may experience sad It's a syndrome of inappropriate ADH. It just patient develop too much ADH, produce too much ADH, and then cause fluid retention. So, for the patient who experiences SIADH, we need to monitor for the urine output and restrict the fluid intake to reinforce these strategies.